Hi.
How's everyone today?
Doing well.
That's good. I'm well. So I have a case that I want to present to you all today and kind of get you all opinion, okay?
Okay.
All right, so I had a patient who came in to the urology office a few days ago, and the patient came in complaining of back pain. He stated that I have back pain in my right mid back. So this was a 58-year-old male with a past medical history of hypertension, nephrolithiasis, anemia that came into the urologist's office with chief concern that started about 3 months ago. The patient states that the pain is localized to the right mid back and points to areas of the costal vertebral angle, but occasionally radiates to the lower back. Patient states that the pain often lasts for 4 to 5 days, describing the pain as dull and occasionally sharp. Patient also stated that pain worsens with physical activity and gets better with rest and over-the-counter medications such as Aleve. He rated this pain as a 7 out of 10. And at the moment when I was examining the patient, he complained that it was a 5 out of 10. Patient denied any pain radiating to the abdominal or groin area, with flank pain being consistent throughout the day. He also reports occasional episodes of blood in his urine with unintentional weight loss. That was approximately 10 pounds over the last 6 months. And he also told me that he feels fatigue frequently. He denied any history of fevers, chills, night sweats. He also denied suprapubic pains, urinary frequency and urgency, troubles with starting a stream, discharge, testicular pain, masses or scrotum pain and swelling.
Okay, so what about his past medical history? I know you said he had hypertension, anemia, and a nephrolithiasis. Does he have anything else?
Yeah, so for the nephrolithiasis, he was in the hospital sometime last year, but he was discharged because he was able to pass the stone.
Okay.
And then for his childhood history, he was a secondhand smoker. The patient denied asthma and MMR. He did follow up with his PCP in September of 2023, in which he had his flu and COVID vaccine done. He also was screened for his eyes, 60/20 bilaterally. They also performed an EKG in which he was tachycardic.
Okay.
So because of the hypertension, he is on a medication, lisinopril, which he takes 10 milligrams per day. He told me that he takes Aleve as needed, which is 440 milligrams. He also uses iron supplements for his anemia. Patient did deny any other medications from over the counter or any other supplements.
All right.
What about any allergies?
No allergy. Patient denied medication allergies, food allergy, or pet allergy.
Okay. Does he have any family history?
So on both his mother and father's side, they are deceased, his grandparents, but his mother as well as deceased from lung cancer at 78. His father deceased from coronary artery disease at 80. He currently lives at home with his 3 children and wife, in which they are all healthy.
Okay. I know you mentioned that he does live at home with his wife and kids, but what does he do for work? Do you know?
Yes, so he works as a manager for a printing industry.
Right. Does he work out, eat healthy,
No.
anything like that?
No, so I asked the patient, does he happen to work out? He doesn't work out. He doesn't have the time to do so. He told me he doesn't really eat healthy as much. He eats whatever his wife cooks for him.
Okay.
But he did deny smoking or any alcohol use, such as beer, wine, marijuana, or anything like that.
Okay. Good.
And is there anything? Is he religious at all? Do we need to incorporate anything?
No.
Okay.
Patient is not religious and doesn't wish to incorporate into care.
Okay.
Good.
What was his review of systems?
So I looked into a few things. The general, which I have already previously mentioned.
Right.
I looked at the skin. There was negative for any changes of hair, nails, rashes, lumps, or lesions. Patient did not having any pain or stiffness, lumps, or borders. I also asked about his respiratory. Patient denied having a chronic cough, hemoptysis, wheezing, pleurotic pain, or shortness of breath. I asked him about his cardiovascular. He said that he doesn't have any chest pain, any murmurs, palpitations, or shortness of breath upon exertion. He also denied having any edema. I also asked him about the abdomen. He did mention that he had the pain in the right mid back, which occasionally radiates to the lower back. However, for his MSK, he denied having any muscle pain, any joint pain, any swelling, stiffness, redness, deformities in the upper and lower extremities. And then for GI, he also denied any nausea, vomiting, diarrhea, rectal bleeding, abdominal pain, and hernias, and change of appetite. All right, so Chris took over and did the physical exam of the patient. And what was your findings?
Yeah. So for our findings, I was able to get a temperature of 98.6, as well as he was tachycardic. When I did check his heart rate, it was 105 beats per minute. His blood pressure was 140/85, which for him, he said that's about normal because he does have hypertension. Respiratory rate was about 22, O2 95% on room air. His weight 65 kilograms, but he has been losing. He has lost 10 pounds over the last 6 months, and our patient is 5'9". So I did do a physical exam on him, and within the physical exam, I did general, which he did appear well developed. He did have the unintentional weight loss. Doesn't really know where that's coming from. He did have that right flank pain that he did come in to the urology office with. He's well groomed, alert oriented, ×3. The positive findings that I did find within the physical exam, I did do skin, neck, respiratory, cardiovascular, abdomen, MSK, as well as GU. But the positive findings that I did find were his skin was a little paler and warm, dry, as well as within the abdomen, he did have CVA tenderness, as well as he had a palpable mass on his right flank, and it was also dull to percussion as well. So those were the positive findings that I found.
So for like differential diagnoses for him, I'm thinking like for general oncocytoma, because he has like the hematuria, the flank pain, and the palpable mass on like that right side.
That could be very possible. Yeah.
Okay, yeah.
My differential is going to be lung cancer. He's had positive weight loss, and then his history of secondhand smoke growing up. But he,
Yeah, I mean, we can, but he didn't present with like a cough, or he wasn't fatigued, no shortness of breath, as well as like he didn't have a loss of appetite, even though he has the weight loss.
Okay. All right.
I was thinking maybe we could rule in like endocarditis, just because he does have flank pain and he did have CVA tenderness. But then I thought about it, and doesn't have fever. He doesn't have a fever. He doesn't have a murmur.
Right.
On physical exam, he didn't have any ulcer or Roth spots, so
Okay.
don't really think that's a possibility.
Yeah.
So I was thinking polycystic kidney cancer.
Okay.
Because he had a positive flank pain, palpable mass, as well as hypertensive.
Yeah, but doesn't really have a family history of PKD, and he doesn't present with any like UTI symptoms or anything like that. So
Okay.
You could probably do some labs.
Okay,
That's true.
I agree.
So in genital urinary, I was thinking maybe like testicular cancer. He did have the weight loss and the back pain, so I think that's something to rule in.
yes, but on physical exam, he didn't have like any swelling in his testicles or like any pain in his scrotum, and he didn't have like any enlarged lymph nodes. So
all right.
So Chris, what diagnostic test did you do for this patient?
So for diagnostic tests, we did end up doing a abdominal CT. With the abdominal CT, we were able to find a 7 centimeter enhancing solid mass in the upper pole of his right kidney. So that could be the pain that he's feeling in his right flank. With it had no evidence of like local invasion or lymphadenopathy, and there was no like metastasis noted. We also did a urinalysis, and it was positive for blood. It was 50 red blood cells
Oh wow.
per high field microscope. We also did a CBC, and he has a history of anemia, which with the CBC it did confirm his diagnosis of anemia. We did do a CMP. His creatinine level was elevated, 1.8. His ALT was 45, so also elevated as well. AST was about 40, elevated as well. So that that is indicating the possible like renal impaired renal function. And then also biopsy was done, and with that, the histology report did confirm renal cell carcinoma with the CD10 antigen.
Okay. And do you have the imaging we could take a look at?
Yeah.
Wow, yeah, I see it.
It's like right there.
Yeah.
Mhm.
All right. Well, due to his consistent dull right flank pain and that was occasionally sharp, worsens with activity, and he did have the CVA tenderness. We confirmed his anemia through his blood work. He had the unintentional weight loss over the 6 months, the history of secondhand smoke, hypertension. He got a lot going on.
Right.
I think we can go ahead and confirm that he has stage 1 clear cell renal cell carcinoma.
Right.
Yeah.
I agree.
I agree.
Yeah. I did have a couple of other differentials on the list as well. Yeah. So I did go ahead and agree with you guys with the oncocytoma. These tumors are seen in other organs that include the adrenal glands, and it is indistinguishable from renal cell carcinoma. So we may have to do some further studies. And then I did want to say he may have lung cancer just due to his secondhand smoke exposure and his decreased weight and the anemia. But I did rule that out because he didn't have the use of accessory muscles, and along with Chris's physical exam, I just didn't think that it fit. But secondarily, he does still have the history of nephrolithiasis, the hypertension, and the anemia that we confirmed.
So what are we thinking for a treatment plan?
So first we're going to start with our patient education. We're going to make sure he's incorporating a healthy diet and exercise because we want to get that managed. Definitely some counseling and support groups since we're showing this diagnosis to him. Definitely continue the smoking and alcohol cessation. That's great for our patient. I definitely want to refer him to a urologic surgeon because we want to see if we can surgically excise the tumor. But if it does metastasize, we want to also refer him to an oncologist. And we should inform him that the prognosis for a 5-year survival with local is 95%, but for distant, it's 12%. So for non-pharm, like I mentioned, we're going to do the surgery. It's either going to be a partial or a radical nephrectomy because his tumor is greater than 7 centimeters. For pharm, that's going to be more the oncologist talking about some target immunotherapy so he can have the conversation with them. But we definitely want to continue him on his hypertension medications, the anemia medications, and also that Aleve for pain. Since we are referring him to the urologist, surgeon, and oncologist for further treatment, he should follow up with them in 3 to 4 days regarding the recent visit with us and his new diagnosis. He should definitely continue routine check-ins with his PCP, doing routine imaging and blood work to monitor the progression and make sure there's no signs of metastases. And definitely we should tell him if he has worsening abdominal pain, back pain, more blood in the urine, changes to the urine color, further unexplained weight loss, fatigue, persistent weakness, fever, chest pain, shortness of breath, he should really go to the emergency department. Okay, so I know I just went over a bunch of treatment options, but we should really talk about some adversities our patient might encounter.
Yes, so I was actually thinking a lot about his secondhand smoke exposure as he was growing up. His parents smoked, and then it was also in homes, schools, works, restaurants, because there was no regulation back then. The U.S. Environmental Toxicology Program has declared that secondhand smoke is a known human carcinogen. And so basically nowadays we have regulations on that. Also, his family support system, no one's supporting him. He's putting his kids through school. So he's more concerned about work and getting his money versus health issues. We have discussed that he can talk to his wife about taking on some of those responsibilities to start helping him out with that. And then health literacy, just based on his cultural background, the time period that he grew up in, he has fear of potential mistreatment, unnecessary tests being performed, as well as receiving unfavorable news. So we're just going to make sure that at the end of each of his appointments that we're giving him pamphlets, notes. If he has any questions, he's free to reach out and call. I'm just looking at the resources necessary.
Great. Smoking has always been such a problem. What are we doing about that?
Yes. And unfortunately for him, there was no regulations put in place. He lives in Maryland, so they do have the Clean Indoor Act, which prohibits anyone from smoking within workplaces, any public space.
Perfect.
Yes. So he won't be exposed to secondhand smoke exposure anymore.
All right. Good. Okay. All right, guys, we did good. We got to the diagnosis. We treated the patient.
Right. This was really educational. Thanks.
Yeah.
Thanks for bringing it up.
Thank you.
Thank you.
And I think y'all too as well.
Thank you.
Yes.